Thanks very much, Art, and thank you for having me. So I'll do just two things today in my 20 minutes. So one is to give you an overview of sort of COVID response work we're doing in collaboration with the Bangladesh government and other important implementation actors in Bangladesh like BRAC. And I'll touch briefly upon the collaboration with the World Bank on trying to design a new social protection system. But then what I'd like to focus most of my time on, given the nature of this particular audience, is some between mobility migration and this COVID-19 crisis. It turns out that migrant households are, I think, uniquely at risk here, and I'd like to share some insights that are coming out of our data on the ways in which migrant households are experiencing this crisis differently than non-migrant households. So let me start with a broader overview of what we are doing, because that will help you understand the data sources that we'll then use to talk about migration during COVID. So when we started thinking about, so by we, I mean YRISE, the Yale Research Initiative on Innovation and Scale, which is a collection of researchers around the world, and we have staff in New Haven. And when we started thinking about the COVID crisis, and especially Bangladesh, which is where I'm from, and I've been doing a lot of work there. So an early insight was that, look, Bangladesh, like probably many other low and middle income countries, will not have the luxury of a lot of testing data to make evidence-based policy decisions on the basis of good epidemiological information. Right? So then we were trying to figure out, okay, how can we plug in that gap? And the idea is that we had been running a bunch of surveys for unrelated purposes, nothing to do with COVID, for the last few years. So we had access to representative samples of households, and we also had good baseline information on them. And so we immediately started conducting 3 weeks ago high frequency data collection, so through phone surveys to a number of different samples. And those samples include a representative sample, includes samples of migrants, it includes samples of refugees, Rohingya refugees, as well as host communities living near those refugee camps. Okay? And so we've been asking them about symptom prevalence. So this is in collaboration with doctors and public health professionals on, like even in New Haven, about 4 weeks ago when we didn't have enough testing, the Yale Institute of Global Health had developed kind of an algorithm on positive COVID symptoms and negative symptoms. Like nasal congestion, that's actually good news, right? And so we basically implemented that symptom module. We also asked people about public health behavior, their knowledge, and then of course, this is going to turn into an economic crisis. And so we asked a lot about income shocks, food insecurity, and what's happening to remittance income for the sample of migrants. As well as returnee presence in their community, because we know that this virus travels via person-to-person transmission, and so migration is an important vector of spread. Okay? And so while we were doing these phone calls, right, it also made sense for us to use existing body of research to try out strategies that might help spread good information. So in this case, we have a couple of social influence strategies that we are experimenting with and quickly experimenting with, getting feedback in a week or two, and then working with the government to see what should be scaled up. So the two types of influence. So one is based on personal appeal. So basically, we know from existing research, and some of it actually done with the World Bank in the past, on how do we spread new agricultural technologies and information about new techniques. Turns out that when people hear it from their friends and neighbors via social learning, that's often more effective than sending it out via, say, extension agents. And so we're basically applying those strategies here. So sending out good information to counter hysteria and stigma, etc., via social networks. Okay? And then the other important issue we face in Bangladesh, as in Pakistan, Nigeria, Indonesia, etc., is that people are still going to the mosque, and then with Ramadan coming, which is here now, it would be even more dangerous when people congregate at mosques, and that's a great way for the virus to spread. And so we worked with Islamic scholars, the Imam Training Academy in Dhaka, right, to develop a script by which we would contact imams at local mosques, because unless these village imams really endorse the message and enforce and help implement, it's really difficult for us to get people in remote corners of the country to listen to any kind of central government directives. Right? And the government itself has now made an about turn in that directive. And other than imams, we're also working through school headmasters, so basically other people whose opinions are respected. So we're sending out a bunch of sort of social influence also via phones to maintain physical distance. And other than that, I'll talk a little bit today about, collecting migration data from various sources, so airport returnee data from the disembarkation cards, collecting data on migration permits that have been handed out in the last 10 years, and in order to make inferences about where the likely hotspots would emerge, where we need to pay more attention. I'll show you some maps. And the idea is that taking all of this data and basically doing some combined economics epidemiology modeling, right? And the reason to put the data together this way is that, all of the models that have been influential in the US, UK, etc., like the Imperial College model, right? That's primarily an epidemiological model focusing on the behavior of the virus and the spread of the virus, right? But especially in low and middle income countries, when we want to evaluate policy, it is vitally important for us to add some behavior, human behavior, into those models. The reason is that, so for example, if you have, say, social distancing guidelines, if compliance is imperfect, right, that will change your predictions on the effectiveness of such policies, right? And so we have to have that kind of behavior. People's knowledge will change your predictions. So we want to add things like that to the model. We want to add human mobility to the model, and also economics, because by economics I mean that the costs here are not only in terms of deaths due to COVID, but the costs may also show up in terms of malnutrition, in terms of hunger, in terms of changes in visiting healthcare facilities for other reasons and so forth, right? So we're trying to put all of this data together to inform more comprehensive models. And then finally, if I won't have time to get into this in detail today, but one of the things we realize is that regardless of what social distancing policy you're comfortable with, it is imperative that we get money in the hands of poor people very quickly, because they're suffering, right? And if they're going hungry, then they're not going to abide by your distancing guidelines anyway, right? And so now you have a problem in countries like Bangladesh and Nigeria, where you don't have the existing infrastructure where you can easily identify who is poor, who is deserving of support, right? How do you actually go and target them? So here we are using a variety of strategies. So the one main one that we're working on in collaboration with the major telecom service providers, as well as the government in Bangladesh, is to look at, so because we have all this survey data, we have some ground truth for a sample of, say, up to 15,000 households, like who's poor, who's deserving of support, and based on these phone surveys, who is hurting the most right now, who are the new poor, right? So now that we have the ground truth, if you merge in the cell phone data on top of the survey data, right, then you can start inferring subtle patterns of cell phone usage that differ among the poor and the non-poor. Right? And you let a machine learning model loose on that information, and it develops, it deciphers those patterns. And if you feel confident that you have a model that's predicting the poor and helping you distinguish the poor and the people who are hurting right now from the ones who are not, or hurting more from the ones who are hurting less, then that would be a really quick way for us to then take that machine learning model, give it back to the telecom service providers, and have them run it on their entire subscriber base of like 100 million or more people, right? And that is a quick and dirty way to identify the poor. And of course, you're going to make inclusion errors, you're going to make exclusion errors, and we are trying to devise a system where there's a human element brought back in, right? Where if the model identifies, say, high or medium likelihood of poor, we send out SMS and ask them a few more questions in order to devise a benefit targeting system cost effectively. So we've started this in Bangladesh on the basis of pre-existing conceptual work in our team, done in Rwanda and in Afghanistan. And then we are in partnership with the World Bank. We're in discussions on how to implement such a system in Nigeria right now. So I'm happy to connect on all of these. So I'm just giving you a broad overview, and I'll we can connect by email. Okay.